UTI in pregnancy. Urinary tract infection is a bacterial infection that affects the parts of urinary system. UTI is limited to the bladder, can be painful and annoying, and it's called lower UTIs. The urinary tract anatomy is the kidneys, the renal pelvis, the pelvic junctions, the ureters, the bladder, and the urethra. Pregnancy and urinary tract infections. Changes in the urinary tract system during pregnancy that is happened physiologically: kidney enlargement and hydronephrosis, compression of the ureters and bladder, incomplete emptying. Urine is not as acidic as non-pregnant state. It contains more sugars and proteins. Types: asymptomatic bacteriuria, silent, caused by bacteria present in the woman's system before pregnancy, may lead to pyronephritis if left untreated. Acute urethritis or cystitis. It is an infection of the bladder or urethra. Symptoms include pain or burning with urination, frequent urination, and urgency. It may or may not accompanied by fever. Pyronephritis is a bacterial infection of the upper ureters and the kidney, upper ureters, pelvic junction, and the renal parenchyma. Signs and symptoms: flank pain, pain or burning with urination, frequent urination, urge to urinate, and fever. Chills, rigors may lead to preterm labor. Severe infection is leading to renal failure and septicemia. The most common causative organism is Escherichia coli. Others: group B, streptococcus, and sexual transmitted gonorrhea and chlamydia. Signs and symptoms: a strong persistent urge to urinate, a burning sensation when urinating, passing frequent and small amounts of urine, hematuria, cloudy or offensive urine. Complications: septicemia, adult respiratory distress syndrome, renal abscess and scarring, preterm labor and delivery, increased perinatal morbidity and mortality, and DIC. Diagnostic evaluation by history and physical exam. Urine examination reveals hematuria, pus cells, and bacterial cells. We could have leukocytosis and elevated C-reactive protein. We could have septicemia, and we can do urine culture and antibiotic sensitivity, and we could do renal function test if we suspect renal injury. Treatment: admission to hospital if needed, IV fluids, IV antibiotics, antipyretics if we have fever, continuation of treatment with oral antibiotic for at least 2 weeks. Antibiotic for 7 to 10 days. We can use ampicillin, nitrofurantoin, cephalexin, amoxicillin, and clavulanic acid. In case of recurrent infections, nitrofurantoin 50 mg or amoxicillin 250 mg at night to continue till delivery as a prophylaxis. Of course, we change the antibiotic if we do a culture and the antibiotic sensitivity is the antibiotic that we use or that we used is not effective against the causative agent. We should convert the antibiotic to another antibiotic that is functioning against this bacteria. Prevention: drinking plenty of fluids, urinate promptly, avoid potentially irritating products like antiseptics, um, keep the genital area clean. And thank you.